My name's Frank Paternoster. I grew up in Staten Island, New York. I'm 27 years old. Growing up in Staten Island was interesting. Everything there was always sort of small town. You're a kid of the neighborhood when you're in the suburbs. We would play sports. We would just sort of hang out around here. This was our playground. The summer prior to high school, we went away to football camp. I got hit at some point, and I was in immense pain. Over the next 2 weeks or so, it got worse and worse, and so I was rushed to the emergency room here on Staten Island, where they thought I had a bruised kidney. They did another CAT scan, and they realized there was a thrombus actually going up to my heart.
It was coming out of the kidney, and they said it was about ½ an inch from the heart. The pediatric urologist said it was out of his hands. He didn't have any expertise in the field. But he knew of a doctor, Dr. Shear, at New York Presbyterian, Weill Cornell, who was an expert in that field, and he would be the only doctor he would recommend Frankie to. So they called an ambulance and rushed us right there.
Frank was diagnosed with a large tumor in his right kidney. What was unique about this tumor in Frank is that not only was it very large, but it extended up into his heart. If a piece of the tip of the tumor were to break off, this would have advanced and extended into his lung, cut off the blood supply to his lung and his heart, and would have been a fatal event.
The night before the operation, Dr. Shear came up to my husband and I and said, "You have to sign the consent forms." He says, "Before you do, I have to tell you, this is major, major, major." And he said it 3 times. He said the operation would take 19 hours, and for 1 hour during the operation, Frankie was going to be clinically dead.
At New York Presbyterian Weill Cornell, we have been focusing our attention on patients who require surgery of this type, that require profound hypothermia and circulatory arrest for the last 20 years.
In order to remove this tumor in its entirety, we would have to open his heart, and that cannot be done with blood flowing through the body. So what we're able to do is lower his body temperature during this case while he's on cardiac bypass.
Then we have anywhere it's up to an hour to open the heart, to open the big veins in the belly, knowing that we have that window of safety.
I just looked at Dr. Shear and I says to him, "Are you a father?" He says, "Yes." I says, "And if your kid had this, you would let him go through this?" He said, "Absolutely. Your son has no other chance." He says, "The thrombus touches the heart. He's going to be dead."
I remember being wheeled into the operating room. I remember the lights. I remember the anesthesiologist asking me to count down from 100, and then everything sort of went black.
After the operation, Dr. Shear came out and said everything went wonderful. No worries about the heart. He said as soon as they raised the heart from 18 degrees to 20 degrees, it started pumping again. Another doctor came over to us and says, "So what do you want to do about your son's cancer?" And I looked at him, I said, "You have the wrong people." I said, "My son just had his kidney removed." He says to me, "Yes." He said, "And the kidney should be 2.5 pounds, and your son was 11.
The standard therapy for this stage of Wilms tumor is to get chemotherapy in what we call the adjuvant or postoperative setting. And that's why we referred him to Dr. Lito to start his chemotherapy to complete and maximize or optimize the chance of cure from this rare tumor.
After he healed fully from his surgery, we began chemotherapy treatments. Surgery had removed all the visible tumor, and the chemotherapy and radiation were meant to mop up any microscopic tumor that would be still present.
You know, in the past, I think 25 years ago, patients had great concerns about waking up with dramatic brain damage. Now we've gotten so good at preserving the organs that we can be much more aggressive with tumors that in the past we may not have gone after.
We're able to take the large volume of tumors that we see and look at them from a genomics, genetics, mutational standpoint to begin to define the genetics of these tumors, and in doing so, we're able to help further define treatments.
Santa.
Fast forward 13 years from the time of this major operation and chemotherapy, and Frank is an unbelievable success.
He's every mother's dream. He's always there, he's always helpful. I think once he hit his own mortality, he became very focused. He knew what he wanted and he just reached for it and got it.
Today I'm most passionate about living the life the way I want to live it. I couldn't honestly say that I'd still be here today if I didn't go to New York Presbyterian, Weill Cornell.
I've thought about Dr. Shear so many times in the last 14 years, you wouldn't believe. I can't wait to see Dr. Scheer again. I can't wait. Hello.
Ultimately, what you're hoping to do is instill confidence in the patient. And you take a 14-year-old kid like Frank, who one day is playing football and the next day someone's telling him he's got a big tumor and he's going to need a big operation to get it out. You got to be pretty brave, to put yourself in the hands of people who you just met 10 minutes ago. We want patients to have the confidence that they can walk into this building anytime with anything and we'll figure it out.
I thank him every day. Thank you very much for letting me keep my son on earth with me.